Hi everyone, I'm Ashley Bassett.
And I'm Catherine Logan.
And welcome to the Sports Talks podcast. On each episode, we chat about the most recent developments in sports medicine and dissect through all the noise so you know which literature should actually impact your practice. Today, we're coming to you live from the American Orthopaedic Society for Sports Medicine annual meeting in Washington, D.C.
The AOSSM annual meeting is the premier sports medicine conference each year, hosting over 3,500 attendees with hundreds of posters and paper presentations, exhibitors, and instructional course lecturers. This year proved to be as spectacular as years past. We were fortunate to have the opportunity to catch up with many of the presenters at the meeting and get their take on some of the hottest topics in sports medicine.
Over these 7 episodes, we're going to be exploring some of the hottest topics in sports medicine with these experts who are presenting at the AOSSM annual meeting.
We are supported by MEOC Orthopedics. MEOC Orthopedics is leading a shift in the treatment of anterior cruciate ligament tears from reconstruction to restoration with the Bear implant. Bridge-enhanced ACL restoration facilitates healing of the torn ACL. Unlike reconstruction, the Bear implant does not require a second surgical wound site to remove a healthy tendon from another part of the leg or the use of a donor tendon.
The Bear implant acts as a bridge between the two ends of the torn ACL. The surgeon injects a small amount of the patient's own blood into the implant and then inserts it between the torn ends of the ACL in a minimally invasive procedure. The combination of the Bear implant and the patient's blood enables the body to heal the torn ends of the ACL back together while maintaining the ACL's original attachments to the femur and the tibia. The Bear implant is resorbed by the body as the ACL heals. To learn more about the Bear implant, including clinical study results and instructions for use, visit www.bearimplant.com.
We are joined today by 2 outstanding guests. Dr. Dean Taylor is the Director of Sports Medicine Fellowship at Duke University Department of Orthopedics, as well as a team physician at Duke. Dr. Taylor is the President of AOSSM, and he is also the Chair of the Feagin Leadership Program. He has a special interest in research related to physician leadership education and development, so we are so excited to hear his take on this topic.
Dr. Carolyn Hettrich is an orthopedic surgeon specializing in sports medicine and shoulder surgery. She is the former chief of the shoulder service at Brigham Womens and a principal investigator for the MOON Shoudler Group. Dr. Hettrich is also the outgoing chair of the Emerging Leaders Committee, which oversees the Emerging Leaders Program. She's been pivotal in the growth of this program, so we're looking forward to hearing what's to come for both the emerging leaders as well as the new BOLD program. So without further ado, let's get to the exhibit hall.
All right, Carolyn and Dean, thank you for joining us for this special episode of the Sports Talks live at AOSSM here in Washington, D.C. Welcome to the show.
Welcome to the show.
It's great to be here.
Awesome. So, Dean, you're chair of the Feagin Leadership Program, and you've published extensively in the area of physician leadership development. So, we wanted to start off with why is this important? Why is leadership important, particularly for physicians?
Yeah, well, let's go back and define leadership, okay? So, as we talk about leadership in healthcare, we talk about the ability to influence others for the benefit of patients and patient populations. So, if I say that again, the ability to influence others for the benefit of patients and patient populations. Yeah. So if you think about it, everybody has a leadership role. Everybody in your clinic, your operating room, your hospital, everybody can influence things for the better. So if we can better develop everyone's leadership skills, we're going to get to better healthcare. And that's what we're trying to do, is to get to better care for the patients by better leadership. And really it's an intentional way to help us interact with our fellow humans better.
Yeah.
And leadership sometimes gets a bad name.
Right.
We frequently blame things on
leadership,
quote unquote leadership, right? But that's not what we're talking about. We're talking about how we interact with our fellow humans, and that's what we're trying to do.
Yeah, Dean, I think that's a great point, because we're often thinking about developing an individual as a leader and for the benefit of that individual. I think sometimes we get lost there, and you make a really solid first point of how it is. That's really not the point. The point is developing that person so they're developing others, and there's a whole big trickle down. Carolyn, you have been chair of the Emerging Leaders Committee. And you helped develop the BOLD program, which stands for Building Orthopedic Leaders Development. So can you tell us a little bit more about this initiative for AOSSM?
So this is a really fantastic initiative we've been working on building over the past several years. And what it is the recognition that we have this amazing group of individuals in the society, and but at some point in time, we need to train this next generation of leaders. And this next generation that's going to be up and coming to lead the society as well. And so what this is looking to do is to take some of the younger or newer members of AOSSM and to start to develop some of those skills so that they can lead within their own practices, their own communities, and as well have those roles in AOSSM.
Yeah. And I stopped by the other day, and it was a great group of people for that kickoff, and they seemed... what was the comment in our committee meeting? They were all talking about how no one looked at their phones for 3 hours.
Which is very impressive.
Yeah. When does that ever happen?
Exactly. So, Dean, as Carolyn mentioned, so part of the BOLD program is mentorship, right? It's learning how to lead, but also mentorship. So can you tell us a little bit more about how we can best mentor the next generation of orthopedic surgeon and how that differs from coaching? Because people lump that together.
Right. And it is a big difference. Actually, if people want to do it, that are listening, want to do a deep dive in this, Carolyn and I and John Dickens and Joe Doty just co-edited a special edition of Clinics in Sports Medicine on leadership, coaching, and mentorship.
Yes.
And
We saw it.
We saw it.
Yeah.
Well, I am. I can promote.
No,
I don't
please
get
do.
any money for it. But
I just happened to ask that question. It's such a coincidence.
Thank you for the team.
That's good.
But I think that's a deep dive. But just in general, coaching is about whether it's in athletics or whether it's in surgeons. And I've been a coachee and a coach, where that coach is there to give you direction and observe what you're doing to try and make you better.
Yeah.
Mentorship, on the other hand, is creating a relationship, and there's a lot that goes into that relationship, and a lot of it is on the mentee and choosing a mentor that's willing to be a mentor, and then building that relationship. And when it happens well, it's magic, because both the mentor and the mentee really grow from it.
And how would you say, you kind of described how coaching and mentorship are different, but they're both good, right? Mm-hmm. So how do you blend those, and what's the purpose? Carolyn, what would you say is that you've had experience with coaching? I know you've shared that before, and that's been integrated into the BOLD program, I believe. How do you see them different, and how do you see them both being helpful?
So the interesting thing in BOLD is that they do provide several sessions of coaching. And again, the coaching isn't as relationship based, and it's not as developing over time, either that sponsorship or that friendship that can come from the mentorship, but it is someone providing, I guess, the little bit of more of professional separation, that kind of that advice and that guidance, and providing that outlook or that advice from the outside with more experience on how you deal with either a difficult situation or a professional growth issue, or something else that you could just use another kind of set of eyes on from the outside, and often has experience kind of dealing with a lot of those issues. Whereas again, the mentorship is that relationship, and I think that they're very complementary. I think in life you need mentors, and even better, you need sponsors. But I do think that having someone that's a little bit more removed and who maybe isn't your friend, who can give you some professional coaching and kind of lead you through some difficult situations, or some help your professional growth, is also highly beneficial.
Can I build off of that?
Yes, please.
Speaking with my AOSSM president hat on, I think this is a huge part of what we need to do for our members, both the mentors and the mentees.
Yes.
And with the help of the Emerging Leaders Committee that Carolyn has led, and now being led by Megan Bishop, and then some, I guess you'd call them gray hairs. Keith Kenter.
You don't have too many.
I'm starting to get them.
Well.
I have a feeling I'm going to get some more.
Check back with him at the end of this
Yeah,
year.
we should congratulate you on your presidency.
Oh, yes, congratulations.
Well, thank you.
And we'll check your hair at the end.
Well, I'd like to do this again.
Absolutely.
Us too.
Next year in Denver, you guys need to do this again.
Yes, absolutely.
but we've got a great team in with the Emerging Leaders Committee. We have Keith Kenter and John Kelly,
Yes.
Who have experience in developing mentorship programs, and they've helped us develop this. And we've got almost 30 mentees that applied to be in the program, paired with 30 mentors that volunteered to be in the program, and they've kicked off their mentorship relationship at this meeting. So we're really excited about that, and all the 18 members, what we're calling playmakers, the early career
Love that
members
name.
that are in
Yes,
the
great.
BOLD
Yeah.
program, they all are part of this mentorship program. So I think it all ties together.
So you mentioned that there's mentors and there's mentees, and obviously the mentees are learning from this mentorship, but the mentors need to learn as well too. So is there a part of the program that focuses on mentor development, teaching them how to be a good mentor?
Yeah, you want to talk about that?
There are. So they're hosting a program also with a group called Great on the Job, who's one of the people who are helping to kind of lead and guide the BOLD program, are having, again, a webinar on how to be a great mentee, how to be a great mentor.
Right.
They also put together kind of some loose recommendations or guidance on recommendations on when to meet and how to kind of help people along those process. So for people who may not be as experienced in mentorship, so that they can kind of have something to go off of and something to build from. But yes, they're trying to work on both sides of it, so both sides benefit.
Yeah, in that Clinics in Sports Medicine, Megan
Yes.
Bishop and Lance LeClaire have a great article on how to be a great mentee.
Great.
And then Robin West has a great article
Yeah.
on how to be a great mentor.
Yeah.
And that's, I think, something important for the young people to learn. Is I think some people, might think, oh, my mentor's just going to, do all these
everything
things
for
for
me.
me.
Yeah.
Do all this stuff for me, and
active
it's
participant.
and it's all going to kind of just start. All the
Yeah.
good things are going to start coming my way, and that's just not how it works. You've got to
Yeah.
actually be a good mentee and fulfill your side of things, and to really get the most out of that relationship.
Yeah, I think personally speaking, I know both Ashley and I have had great mentors, and so for me, Matt Provencher was with me initially at Mass General when I was a resident, and then timing wise, I ended up landing in Vail for fellowship right after his transition there. So I got him on both ends, which was really nice. But he, I think he's the one that sort of really taught me that it's not. We don't just kind of walk you through this process here. You have to show me your interest. You have to show me your dedication. That, if we discuss a project, this is not going to just be done for you. You have to, come to a meeting with an agenda. Come to me with questions, and then, do your part. Get your work done.
And I would say that I 100% would not be anywhere near where I am
Yeah.
today without my mentors.
Yeah.
So I'm unbelievably appreciative and looking forward to returning the favor
Yeah.
in life.
I would agree with that 100%.
And I feel like you made a really good point pointing out there. Mentorship, it's not like coaching is a one-way street.
Right.
Mentorship is a two-way street, and they talk about it developing into a relationship, right? So it's a mutually beneficial relationship between two parties. So you have to play your part as well. So I think you make a very good point.
Yeah, and it turns into that. Hopefully, in some cases, you get a sponsor and someone who's actively then promoting you. And that's really where I think if you can get that friendship and that sponsorship, that you really kind of luck out.
Yeah, and I think we all know there's some big programs with a lot of reach, and then there's some smaller programs as far as residency. And so I think AOSSM is now offering programming that no matter where you are in the country, you can apply, you can figure out ways to get involved, because I do think there are those examples that you're at a smaller program and maybe you just don't find that person, because we've talked about this before in our Emerging Leaders Committee, that there has to be a connection, and sometimes it just doesn't work.
Absolutely. So we kind of want to talk about something we talked about at the Emerging Leaders meeting yesterday that we had. So we've been focusing so much on leadership, that building the next leaders, but not every early career, member wants to be a leader, right? But yet we're focused so much on fostering kind of the development of early career members. So why is that important? What other things can early career members learn and build and contribute to AOSSM that's outside of leadership?
Well, I can answer that. Is that
Go
okay?
for it.
I think you're
I just pointed at you,
Yeah.
but no one can see that.
Well, that's what we're trying to do.
Yeah.
And I think it's on both sides.
Yes.
Okay. What can they do for the AOSSM? But what can the AOSSM do for those early career members?
Mm-hmm.
And I think that's a really important part of what our strategic initiatives are going to be for next year.
Mm-hmm.
we want to create more opportunities for those early career members. And to your point,
Yeah.
Catherine, those people that may not be in a big academic
Right.
medical center, how do we create those opportunities? Committee positions, workforces. I think the BOLD program is an example of how we can engage people that may not have those opportunities. Certainly the resident and fellows forum that we had yesterday was standing room only.
Awesome.
And then there's engagement in small groups with really established orthopedic sports medicine surgeons. And I walked into that room and it was incredible. And the diversity was incredible, the energy, the enthusiasm. Those are the kind of things that I think the residents, fellows, early career members can bring to the AOSSM, but the AOSSM is also bringing to them these opportunities, and we're going to really focus on what we can do to expand those opportunities and really enhance the member benefits for our early career members.
Yeah, wonderful. So Carolyn, you're the outgoing chair of the Emerging Leaders Committee. Megan Bishop, you already mentioned, is taking over. You've obviously done a wonderful job over these last years. We both feel, Ashley and I have volunteered on multiple committees. We learn a lot every time we volunteer for AOSSM. What are your sort of takeaways as you leave that chair position and move forward? What have you grown and learned from that being the chair of that committee?
I am definitely sad to be leaving this position. It's been a great, 4 years. I wish I could stay on forever, but you guys are definitely getting an upgrade with Megan. And I would say it's been a fantastic experience seeing the dedication of AOSSM to its younger members in terms of resources and time and what they've been willing to do in terms of starting the BOLD program, being supportive of even things like nightcaps.
Yes.
I will tell you, in that running the nightcaps.
Maybe for the audience you can
Yeah.
explain what nightcaps are.
Sure.
So they're amazing. They really are.
The nightcaps have been these evening time Zoom meetings in which we have experts in the field come and get together and talk to our under 45 or within 10 years of practice members. And they've been on topics anywhere from practice management to research to sports coverage to, recently was legal issues. And they're supposed to be kind of an intimate environment where, there's 20 to 30 people usually on the call, sometimes a little bit more, sometimes a little bit less. And give a chance for people to create relationships. And I can let Ashley in a second, mention a
share her
relationship
story.
that she had from a nightcap. But they've been an excellent thing, and an excellent kind of opportunity for me and for everyone on these calls to get to know members, the senior members of the society, and for the senior members and the more experienced members to share a lot of their experiences with these younger members that are starting all their practice. And it's been fantastic. And I'll tell you that throughout the course of doing these nightcaps, it's almost unheard of for anyone not to immediately say yes and be happy to participate.
Sure.
And they've been wonderful sessions that people have really gotten a lot from. And Ashley is one of our biggest success stories.
Yeah. So I'll tell my story. So big plug for the nightcap, because first off, it's beneficial for two things. One, it's an intimate setting. So it's you and just a handful, obviously a handful, 20, 30, sometimes up to 40 people, but still a small group where you're interacting with really some leaders in AOSSM in a more intimate setting. You can ask your questions, they give email, you can reach out to them. And then two, and this is really the important part, is a tangible impact. So I feel like a lot of times when you're early on in your career or in training, someone will present and they're like a leader of some organization and they're like, yeah, this is how I got there. But there's not tangible action items to get there. There's no roadway and you don't have to pave a roadway, but you at least, inform people how you got there or offer to mentor people. And I feel like a lot of times that's lacking. And that's what I think the Emerging Leaders, the nightcap build, bridges that gap. So I attended one on how to get involved with Olympic team coverage. As Catherine and I have spoken about, we had very much an academic training. We both trained at Harvard. I went to Rothman for my fellowship, loved working with all the Philadelphia sports teams, go Eagles. And when I transitioned to...
She's just saying that because I already did a shout out for the Giants.
She said, "Go Giants!" I gotta throw a "Go Birds" in there. And when I switched to private practice, I really missed that. And it's really, I think, hard when you're not associated with an academic institution to break into that field. So Jo Hannafin was giving the talk on USA rowing and her involvement. She said, "If anyone's interested, reach out." So I reached out to her, and she connected me with Ellen Casey at USA Gymnastics, and I've been working with that organization since. And if you had told me that was going to happen from attending a nightcap, I would have never thought that. But there's you're connecting people who want to mentor, who want to help, with people who are really looking for that, and it just leads to these really lasting impacts. So attend the nightcaps.
Yeah.
It really is. Sorry, that was long-winded. I'll
No,
let you
it
take
is.
over
It's
from
great.
there.
So we were going to discuss a little bit. So Dean, thank you for service of our country. We would love to hear a little bit more about your military experience, how that's informed you as a leader, in your day-to-day in the operating room, directing fellowship, all those sorts of things. How does that inform you?
Yeah, that's a great question, because it does, and I think it was necessary for me, but it's not sufficient. And leadership is hard.
Yeah.
One time, someone asked a good friend of mine, can you share with us a time where you failed at leadership? And this was a 4-star general. He said, well, when would you like to start? This morning?
Yeah.
Or how far back do you want me to go? Because we fail every day. And I think for me, the foundation I got from my military experience for leadership was 1, integrity, and the importance of integrity for leaders. 2, the importance of service. And then probably the hardest thing that I got from West Point that I've had to live with is something called the duty concept. Doing the right thing all the time, even when no one's watching.
Right.
And you have to live that, and that's a burden sometimes when you see people taking shortcuts, and
Right.
and you want to live to that. And so from West Point, and then being an orthopedic surgeon in the Army, I learned those things, and I thought I knew a lot about leadership. And then when I started on the faculty at Duke in 2006, I thought, well, maybe we could make something happen here. I mean, Duke is a place that has a great business school.
Right.
There's this nationally known leader at Duke that all the Duke haters out there, you can cover your ears right now, but Coach K is probably the most phenomenal leader that I've known, and fortunately I've developed a close relationship with him. And I said, with my background and all the resources that we have at Duke, what can we do better than anybody else for our fellowship program?
Yeah.
And I said, well, we could introduce intentional leadership education as part of the fellowship. And that started a transition and a transformation of our fellowship. It led to the Feagin Leadership Program. It led to the Leadership Education and Development curriculum for the entire School of Medicine at Duke. And the impact is now incredible. And along the way, I had to learn that, hey, maybe I wasn't such a good leader. And for me, the military gave me a foundation from which to build. But I would say over the last 17 years, I've learned more about being a more effective leader in healthcare than I did from all my military time.
Well, and I'll add, we grew up going to Seton Hall games, but there's something called a master class. Have you seen this? It's NAP, or so Coach K has one. We actually watched it as a family. So with my 2 boys, we watched the whole course, and I mean, honestly, I felt it was really helpful as a family just to sort of share those traits with my boys. And what he talked about was, I believe it was his final home game. He lost, correct? And he shares...
To some school only 8 miles
yes,
away from
I didn't say it aloud.
Thank you.
To some school no one knows.
this random program. And, he talked about how his immediate feeling was like, how did you not win this for me? Like, this is so, you know what I mean? And how that, even as evolved as he was as a leader, in that, sort of final moment of a home game, he felt like he failed, and so it's just, anyway, it's a little promo for the master class, because it is excellent. Really, 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 really strong.
Yeah, Yeah, absolutely. Well, Carolyn, I wanted to ask you a question. As we are both private practice physicians, we want to know what advice you have for AOSSM members that, again, they want to get involved with AOSSM, they want to, learn leadership training, but they're in a non-academic center. What kind of opportunities exist for them at AOSSM that you can advise them?
So we do recognize that that's a significant portion of the
Yes.
membership, and so we have had 2 nightcaps that have been fantastic, looking at just that question, and they've been looking at research, how to get involved in research within private practice, but also, again, how to get involved with the society. And the society, I don't believe there's any barriers if it's academic versus private. You still can apply to the committees, and the committee openings come up every fall, I believe in September-ish, and run for a couple of months. And you could still apply to any of the committees that have openings. And there's still, like I said, we've had the nightcaps. I'm sure they'll continue on how you can still be an effective member of research in private practice. And one of the easiest ways as a private practitioner is if you get involved in multi-center studies. And I'll tell you from personal experience that within our multi-center study, one of our best participators in terms of both enrollment and follow-up, he's in private practice. It's Keith
you
Baumgarten.
shared that.
Yeah.
Oh yeah, he does a wonderful job. And so I think that a lot of the previous stereotypes that used to exist have really broken down with all of the things with Zoom, and we're more interconnected. And so I don't really think that there are as many barriers that exist as before. So you can still do research, you can still be involved in the society and still have the valuable input. And you may even have a better business sense in some of the things that you could kind of bring to the table. As well, because you might be involved in some more of those decisions. So you can definitely get involved.
Absolutely. So can you tell us, that was such a great nightcap that was held. It was Keith and Shelbourne, Dr. Shelbourne, that shared that. And I found Keith's insights to be really interesting because that's also something that we're both interested in research, being private practice. I'm in a medium-sized practice, so that can be challenging. Can you share with our listeners some of the takeaways from that? What are some of the advice that Keith had given in terms of maximizing that?
Keith had some really fantastic advice, and his was to start with, you don't have to have a research assistant. You don't have to have somebody that lives with the title of research assistant. His administrative assistant, who was fantastic, was able to take on a lot of that role. He has almost 99% follow-up, so was able to, call patients and
Does he drive to their house?
So he actually did meet a patient in a Walmart parking lot, if you remember, that he shared. And that's his way to get involved, his way to contribute. And so he for a long time just had an administrative assistant or a nurse who would do that role. And so again, it doesn't have to be that formally defined research assistant. So you can make anyone on your staff who's willing to be able to do that. And then his desire to contribute. And so, like I said, he did meet a patient in a Walmart parking lot to get a shoulder exam. So, if you're
get it done.
If you're willing and you're resourceful, I do think you can do anything.
And I think, and correct me if I'm wrong, but I think there's advantages to being in private practice where you don't have some of that administrative workload that you have in an academic medical center.
Yes.
Some of those layers of bureaucracy actually make it harder for many of us to do research.
For sure.
And more flexibility in your schedule as well too. Catherine and I talk about how, yes, it's lost revenue not doing a certain clinic day or OR, but you have the flexibility in your schedule to be able to do that. A lot of times if you're in a teaching appointment, you don't have that. So it definitely is a balance.
Yeah, for sure. Well, the last thing we want to touch on, Dean, as we said, you are now our president. Can you provide our listeners a little bit of insight to your plans and your hopes and your dreams for this presidential year?
Absolutely. Number one, I'm just excited for the opportunity and to follow in the footsteps of amazing presidents that have gone before is a little bit daunting.
Yeah.
Right? That said, we have such an amazing organization that it's not just about one person. It's a huge team effort, and I'm just thrilled to be part of that team. We have a great strategic plan with pillars of research and education and community. And for me, the strategic initiatives for this next year that I really want to emphasize are, yes, research and education and building off of what's already been done. But really two other things, and one of them is community. in building our overall sports medicine community nationally, internationally, with other organizations, with other sports medicine surgeons from across the country, from across the world. That's huge, but also building our community within AOSSM. I grew up in this organization where I bring my family to every meeting.
Right.
Yeah.
And I'm talking to our early career members about that, because what we've been told through the years is, oh, people want to come to the meeting and get all their CMEs, and so we're going to have programming all day long. And what I'm hearing is, well, now we don't necessarily have to do that. We can get our CME
Right.
online.
Yep.
There's a variety
Right.
of ways we can do that. And so I want to introduce ways that our members can network better
Yes.
with each other, but also a place where
Community.
in Denver next year,
Yeah.
we're going to have great things where you bring your family
Yeah.
and you get to meet your friends, your peers,
Yeah.
other orthopedic surgeons, and other people involved with AOSSM. You get to meet their family.
Yeah.
Because
Yeah.
my kids are friends with kids of people that I met at AOSSM meetings. And I want to bring that back. And so that's one other area that we're really going to emphasize as community. And then, as we've been talking about, the other one for our strategic initiatives is leading for the future, and an emphasis on our early career members and all early career members, in finding ways that the AOSSM can make early career members experience within the AOSSM better. Where, yeah, they're going to get the education, but we'll get that networking. We'll get residents and fellows and opportunities to meet with experienced orthopedic surgeons that have been longtime AOSSM members. All those things that we've been talking about, in addition to the mentorship program and the BOLD program, so we can prepare for the future. And those are the
Yeah.
things that I'm really excited about.
We are too.
Us too. Yes. That's great. Awesome. Well, thank you both so much for being here
Yeah,
today, taking
it
time out
was
of your very
so
busy
nice
schedule,
to have
especially
you
on
both.
this
Having us.
Saturday, and coming here. So thank you so much.
This is a lot of fun,
Yeah, this
and
was great.
I'm looking forward to doing it again in Denver.
Absolutely. Us too.
Thank you.
Yep.
Thank you.
Thank you for listening to this episode of the Sports Talks. We hope you enjoyed the discussion as much as we did.
Make sure to subscribe on Apple, Spotify, or wherever you get your podcasts to stay up to date on all things sports medicine. Exciting announcement, we are also now on YouTube. You can find links to all of our social channels and our contact information on our website, www.thesportstalkspod.com. We love to hear from you.